Now, the health department in Central Visayas will abide by the order of President Duterte to follow national quarantine and testing protocols. It says protocols in the province are based on scientific data. Returning Filipinos landing in Cebu's international airport undergo a swab test upon arrival. This is contrary to IATF protocols, which require them to undergo quarantine in a government-accredited facility for 10 days and get swabbed on the 7th day of their arrival. We now go above and beyond the headlines with the region's chief pathologist, Dr. Jean Loreche. Dr. Loreche, let's begin with a scientific explanation, an explanation from you on the scientific basis for this kind of a protocol in your province. Can you tell us why it's like that?
Yes, good evening, and thank you so much for inviting me. Well, first off, we know, and based on our data on the ground, that by conducting a swab test upon arrival, we have isolated positive cases as well. Meaning to say, you're able to extract immediately those that are going to be positive from RT-PCR. And we know already that the incubation period of the virus is 7 to 10 days. Meaning to say, if from the place of origin where they come from, they are already harboring the virus, then there is that great probability that we would be able to detect them upon arrival. And then, of course, while they are waiting for their results, they are placed in our hotel quarantine facilities. And usually, in 2 to 3 days' time, the results are out. So if they're negative, then they're released to their LGU for the remainder of the quarantine and to do the second swabbing, which is on day 7. But for those that are not from the one Cebu, then they are also retained in the hotel quarantine facilities for the 7th swabbing and released on the 10th day.
Well, wouldn't it also be much safer, ma'am, if they just stay, anyone who arrives in the province or, well, in the country for that matter, no, stays in the quarantine facility for 10 days or 14 days? Because although I understand what you're saying, no, maganda nang mahuli ito upon arrival, no, pero posible kasing yung 5 to 7 days, uurong yan eh. Posible namang hindi siya lalabas sa day of arrival. It's possible. It could come out, it could manifest on the 5th or the 7th day.
That's correct. And we have already foreseen that because that is part of the science of understanding coronavirus at present. That's the reason why we release them for further quarantine, either in their homes, if it qualifies as a quarantine, which is also part of, the guidelines that we have been following, and or in the barangay isolation facility as per, if they do not qualify for their homes to be quarantined. And of course, there is a close monitoring. What is beautiful here in One Cebu is the processes and protocols are in place. There is already involvement of the LGU, including the Barangay Health Emergency Response Team. So we're not really afraid of releasing them, asking them to be monitored and to follow the rest of the quarantine periods.
But in the end, you gave in. Well, Cebu gave in, no, and said, okay, we're going to follow IATF protocols, no. And it's not something that you regret, right? You still think that this has enough scientific basis.
Right now, we still do the protocol of 2 tests, which is upon arrival and on day 7. We just finished our meeting with the governor and the rest of the stakeholders, meaning to say all the various government agencies involved with our processing of our OFWs and ROFs. And coming from the meeting, it still stays as it is. We are still following the protocol. And we believe that we are not disobeying the order of the president, because at the end of the day, these are just innovations on what is really, truly happening on the ground. I think we have to also consider the fact that our OFWs and ROFs, they are only here for a short period of time. And so we have to understand that some of them are here for medical emergencies and maybe to attend the burial or to attend to a sick relative or family member. And you can just imagine the stress and the distress that they are going through being, on quarantine in a hotel, that sometimes these hotels, or the quarantine facilities, we have to also face the fact that these are not manned 24/7 by, being disallowing them any given point in time for the 10 days that they're there, not to be allowed to go out or to interact with the rest of those who are in the same facility. So the chances also of them transmitting it amongst themselves is also there. Secondly, we take care of our OFWs because they are the unsung heroes of our country. And I believe they would be so excited also to be home with their families and empowering them to take care and make sure that they do not violate the quarantine protocols that they are sworn to obey, especially with the minimum public health standards.
So, ma'am, this is really a balancing act, a very delicate balancing act, right smack in the middle of a pandemic. Dr. Mary Jean Loreche of DOH Region 7. Ma'am, thank you very much for joining us.